Erectile dysfunction, or ED, is like that thing your buddy always jokes about, you know? It's more common than you think, and it affects millions of men around the world, especially in Brazil. Basically, it's the difficulty in getting or keeping an erection firm enough to have good sex, and that can mess with anyone's self-esteem, right? Not to mention your love life. The causes are many. It could be a warning sign for other health issues like heart problems, diabetes, or even obesity. But don't worry, medications, cigarettes, that extra beer and daily stress can also be the villains in this story. The important thing is to know that with the right help at the right time, you can say see ya later to ED and get your confidence back in the bedroom. Subscribe, like, and hit the bell so you don't miss any videos. Lately, medications like Viagra and Cialis have become practically synonymous with a quick fix for ED. They belong to the group of phosphodiesterase type 5 inhibitors, or PDE5, complicated names for something simple increasing blood flow to the little fella. And there's no denying, Viagra and Cialis have given ED treatment a boost, giving many men back the pleasure of their sex lives. But listen up, guys. It's good to remember that they're not miracle workers. They're not like those miracle pills that promised the moon, you know? Before you run off to the pharmacy, the best thing to do is have a chat with your doctor to see if it's the right choice for you. To understand how Viagra and Cialis work, we first need to understand how erections happen. Imagine this: the mood is right, the body releases nitric oxide, a chemical messenger that relaxes the muscles in the penis. That's where our stars come in. Viagra and Cialis give that nitric oxide a boost, blocking the PDE5 enzyme that tries to crash the party and lessen the effect. With PDE5 out of the game, nitric oxide reigns supreme, blood flows freely, and the erection stays firm and strong. But remember, Viagra and Cialis only kick in with a little help from excitement. Don't just take the pill and wait around, okay? If ED is bothering you, talk to a healthcare professional to discuss the best options for your situation. Viagra, also known by its more casual name, Sildenafil, is a medication approved by Anvisa to treat erectile dysfunction. It usually starts working within 30 to 60 minutes after you take it, and its effects last about 4 hours. And there's something for everyone, or rather, every need. Viagra is available in several doses, and your doctor will decide the right one for you, taking into account your health history and the severity of your ED. In general, it's pretty easy to use, but like any good medicine, it can have some side effects. The most common are headache, that tomato red face, stuffy nose, and in some cases mild heartburn. In rarer cases, there can be more annoying effects, like priapism, which is an erection that won't go away, or even sudden loss of vision or hearing. Cialis, also called Tadalafil, almost a tongue twister, is another medication approved by Anvisa to give erectile dysfunction the boot. It gets to work quickly, about 30 minutes after you take it, and its effects can last up to 36 hours. Now that's a trooper, right? This means that with Cialis, you have almost 2 days off to enjoy time with your partner without worrying about the clock. And for those who are always ready for action, Cialis also has a daily version to be taken every day in smaller doses, perfect for those who have a more, shall we say, fast-paced rhythm. As for side effects, it follows the same pattern as Viagra: headache, red face, stuffy nose, and sometimes heartburn. Finding the right amount of Viagra or Cialis is like seasoning your food, essential for a delicious result. The ideal dose depends on several factors, like your medical history, the severity of your ED, and other medications you're taking. For Viagra, the starting dose is usually 50 milligrams, taken an hour before sex. Depending on your body and how you respond to the medication, the dose can be adjusted to 100 milligrams or decreased to 25 milligrams. As for Cialis, for occasional use, it usually starts with 10 milligrams, taken at least 30 minutes before the action. For daily use, the standard dose is 2.5 milligrams or 5 milligrams, always at the same time. Just like in a soccer game, Viagra and Cialis can have some side effects, but don't be afraid to get on the field. Most of the time, they're mild and go away on their own, like a bad pass that didn't result in a goal. The most common ones we already know: headache, red face, stuffy nose, and that annoying heartburn. In rarer cases, more serious situations can occur, like priapism, that erection that won't go away, sudden loss of vision, or hearing. If that happens, it's a straight red card to the emergency room. For more information about side effects, talk to your doctor or pharmacist. They're the coaches of your health team. Viagra and Cialis can clash with other medications and cause a real mess. It's like mixing oil and water. Better to avoid it, right? That's why you need to be upfront with your doctor and tell them about all the medications you use, including over-the-counter ones and even teas and supplements. Nitrates, for example, are used to treat angina, and using them with Viagra or Cialis can be dangerous, causing a sudden drop in blood pressure. Alpha blockers, used for high blood pressure and prostate problems, can also cause this unwanted effect. So, before you get in the game, talk to your doctor to find out if it's safe to use Viagra or Cialis, taking into account your health history and the medications you already use. Viagra and Cialis may be the stars of the team, but having a healthy lifestyle is crucial to boost the results. Simple changes can make all the difference, like losing a few extra pounds, quitting smoking, cutting back on the beer, and finding ways to dribble around daily stress. And we can't forget about food. A balanced diet, like what athletes eat before a big game, is essential to keep everything working perfectly. By adopting these healthy habits, you improve your overall health and even prevent erectile dysfunction. If erectile dysfunction is sidelining you, see a doctor to help you turn the game around. They're like an experienced coach who will help you identify the cause of the problem and map out the best strategy for you to get back to peak performance. During the consultation, they'll want to know everything about you, your medical history, the medications you use, and even your habits. Based on this information, they can recommend the best treatment, whether it's medication like Viagra or Cialis, lifestyle changes, or even therapy. Remember, erectile dysfunction is more common than you think, and it can be treated by seeking medical help, adopting healthy habits, and keeping an open dialogue with your partner. You can overcome ED and have a more enjoyable sex life. Prioritizing your sexual health and well-being is like lifting the championship trophy. You improve your overall quality of life and strengthen your relationships.